Good afternoon. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here today to give an update on all things related to COVID-19 here in Chicago. We will start with doing an update on our case epidemiology. What's happening with our cases? Where are we seeing the increases? What do people need to know? Then we'll do a little bit about vaccine. We continue to make very good progress. We'll give some numbers there. And then finally, we will address the news from this morning related to the pause in J&J vaccination. So as always, all of our data is available at chicago.gov/coronavirus. And everything that I show here, we will post on the website and is publicly available. So first of all, we continue to see increases in Chicago in our case rates, our positivity rates, our emergency department, our hospitalizations, and our ICUs. However, we are seeing those increases slow. So at this point, we're averaging 691 new cases of COVID every day here in Chicago. That puts us in the high-risk territory. We actually were previously in the very high risk because the rate of increase had been so great. But now we're back in high risk. Still a concern, still definitely need people wearing masks, social distancing, not taking unnecessary risks, and being very careful with gathering unless everybody in the group is fully vaccinated. Our test positivity is at 5.7%. That would be at a moderate risk, but because of the rate of increase that we're seeing, is also at a high risk. Our emergency department visits are at 130 per day in the very high risk category. And our ICU occupancy is about 110 beds per day across Chicago with a 22% capacity. Just to show you what some of this looks like graphically. Here is what our case rate looks like overall. You can see that that average of about 700 new cases per day is definitely up from where we just were in March, but it's much, much lower than the about 2,500 new cases per day at the top of the second peak. So we're keeping a close eye on this. We need everybody to continue to practice caution, but have been pleased to see some flattening of that case increase. What is driving this? Very much younger adults. And if you look at the graph here, and again, we'll post this online, you see that case rates overall remain highest among 18 to 29-year-old Chicagoans, followed by those in their 30s, their 40s, their 50s. The only group that we are not seeing case increases in are people in their 60s, 70s, and 80s, reflecting the higher vaccination rates and probably the more care that those groups are taking. And that's part of why we're not seeing the hospitalizations increase as much as we might otherwise. Where we look at this by race ethnicity, we are seeing case rates increasing and similar across all major race ethnicities in Chicago. What you see here, the red line represents white Chicagoans. And for most of this surge, we were very disproportionately actually seeing new cases among white Chicagoans. But just over the last week, we're now seeing some more increases among Black Chicagoans, Latinx Chicagoans. So at this point, this really is widespread. And I want to say broadly that no matter who you are or where you are in Chicago, COVID is on the rise. We're vaccinating people as quickly as we can, but in the meantime, we need people practicing caution. This is what our geography looks like. So we are still very much seeing disproportionately cases across the north side of Chicago, differently than what we were seeing for months. And this is just in comparison to other parts of Chicago, but just highlighting that part of the reason why we are seeing many more cases is this was the area of Chicago that had been less hit by COVID previously. There's probably less natural immunity, more opportunity for cases to spread, and perhaps a little bit of misplaced vaccine confidence. We love the confidence in vaccination, but we still have a long way to go to get even the more vaccinated parts of the city highly vaccinated enough to be able to completely stop COVID. Here's what our hospitalizations look like for Chicago residents. So you can see, just again, over the last month, we've seen some increase there. We're still at about the rate for Chicago hospitalizations that we were last summer. And although these are on the increase, it's not been dramatic at this point. Our goal is to keep it that way. And getting our oldest Chicagoans and those with underlying medical conditions vaccinated remains the most important thing to do there. We are tracking what are called breakthrough cases in Chicago Chicago very closely. If there is someone who is fully vaccinated, meaning they've gotten both of their vaccine doses and they're 2 weeks post that second dose. We have seen some cases of COVID in those individuals, but it's very rare, and we have not seen it, particularly in our long-term care facility settings. We've not seen that into people needing to be hospitalized or dying from COVID. There have been a few examples of that across the state, but broadly, these vaccines remain very safe and very protective against COVID, and they're part of why our hospitalizations are looking the way they are. This is what across all Chicago hospitals, whether they're Chicago residents or not, where we are in terms of people in the hospital with COVID. You can see here, as of today, we're averaging just over 330 people in non-ICU with COVID-19. Again, that's up just a little bit from where we were a month ago, but it's nowhere near the 1,200 to 1,400 that we were seeing at the peak. And ICU, we've got about 110 in the ICU across all Chicago hospitals. Again, on a gentle increase there, but not near the 300 to 500 that we were seeing at the other peaks. So this is why we continue to monitor closely, but are very reassured that the vaccine continues to work really well for the most vulnerable folks, and that broadly, at least related to the healthcare system, we remain in reasonable control at this point. Similarly, we've not seen any increase in deaths. We are averaging 3 to 4 deaths per day among Chicago residents, similar to where we were last summer, with no sign of increases at this point. With the slight increases in hospitalizations and ICU, we may see a small increase there, but at this point, this has also not been a cause for major concern. Our vaccine efficiency goals, we hit these every single week. I want to highlight that we are among the best jurisdictions in the entire country, outperforming the other large cities, really outperforming most of the states that I'm aware of. We set a goal that every week 95% of the vaccine that comes to Chicago is allocated out to appointments, out to providers. We've hit that goal every single week. Last week, 97% of our doses that were allocated were distributed. And then secondly, we set a goal that all of that vaccine would get into arms and be reported within a week. We set a goal that at least 85% of our vaccine would be reported within a week. And in fact, we've been exceeding that every week too. Last week, 90% of that vaccine was in arms and reported. Really remarkable, and I want to thank my team, but also the hundreds of providers across Chicago that are really making sure every dose of vaccine that is coming to Chicago is being used quickly. Here's where we are in terms of coverage. If we look at people who are over 65, 62% of them now have gotten at least a first dose of vaccine. If we look at Chicagoans who are over the age of 18, 46% have gotten at least a first dose. So I expect within about a week, half of Chicago adults will have gotten a first dose of COVID vaccine, which is a really good benchmark there. And if we include all Chicagoans, including children, 37% have gotten that first dose. And if we look at the group that's completed COVID vaccination, just under half, 47% of our seniors over 65 have completed their vaccination. That's part of why we're seeing better hospitalization rates in that group. Just over a quarter of Chicago adults have now completed vaccination, and just over 1 in 5 where we look at all Chicagoans. So making very good progress, but still need to very much continue vaccinating. We have a lot of mobile vaccination efforts planned across the city. So related to the Johnson & Johnson news, which I know is what many of you have the most questions about. I addressed a number of them on Facebook already this morning. In case people are not aware, I'll start with just reading a brief statement, and then I'm going to go through in some detail the various ways in which the city of Chicago was intending to use Johnson & Johnson vaccine over the next few days and what our plans have been in that context. So vaccine safety is, of course, always our top priority. And in accordance with a recommendation from the CDC and the FDA, the city of Chicago has paused administering the Johnson & Johnson vaccine while federal health officials complete a review. We're working closely with partners at all levels to determine how this impacts the city's vaccine operations. Federal agencies are investigating very rare reports of a severe type of blood clot with low platelets that occurred in 6 individuals after receiving the J&J vaccine. 6 among nearly 7 million people who who have received J&J across the U.S. We are not aware of any local cases of this in Chicago or in Illinois. While incredibly rare, anyone who has received the J&J vaccine who develops a severe headache or abdominal pain, leg pain, or shortness of breath within about 3 weeks after receiving vaccination should contact their health provider. But I want to reiterate, this is very rare. This recommendation does not affect Pfizer or Moderna in any way. There's been no link with these blood clots in people who have received Pfizer or Moderna, despite about 180 million doses of Pfizer and Moderna having been administered. Vaccination remains absolutely critical to protect Chicagoans from COVID-19, and we will, of course, share additional information as we receive it. Related to how J&J vaccine has been used to date here in Chicago, we have 78 providers in the city of Chicago outside of city of Chicago operations that have received Johnson & Johnson in the last 2 weeks. Much of that was small shipments of perhaps 100 doses that went to smaller medical providers. We've instructed all of them to put a pause on administering Johnson & Johnson vaccine while this investigation is underway. Over 42,000 city of Chicago residents have received a Johnson & Johnson vaccine. Over 47,000 city of Chicago residents have received a Johnson & Johnson vaccine, and we've administered about 43,000 here in the city. And we were intending to administer about 13,000 doses of Johnson & Johnson this week that are currently on hold and being rescheduled. And I'm going to talk through, actually at an individual level, what each of those were, because I know people who probably had appointments for Johnson & Johnson had questions. I, again, really want to thank my team. We are very prepared for situations like this. Team was working from when we learned about this early this morning to make contingency plans, and I'm very confident that we will be able to continue here without major disruptions. So first of all, Chicago State University had been administering Johnson & Johnson vaccine. We are changing the vaccination type for that Chicago State location immediately to Pfizer. And we did not have appointments scheduled today, so beginning tomorrow, people will be able to keep their appointments as scheduled, but they will receive the Pfizer vaccine instead at Chicago State. We'll be scheduling first and second doses as scheduled there. And all of the people who were scheduled to get J&J appointments, we will move them over to Pfizer. There's already been email communication that went out to all registered appointments to tell them about the vaccine type change, but they should arrive as planned. And we are working with appointment scheduling to reflect Pfizer, and we'll be reopening the ability for people to schedule Pfizer appointments at Chicago State this afternoon. Secondly, we have paused vaccination through aviation. We were doing employer-based vaccination at O'Hare and actually had a special event at Midway today. Those are postponed at the moment while we're waiting for more information. Appointment cancellations, emails have already been set. There are some stakeholder calls going on, and we'll make some plans for that group once we learn a little bit more. Our Protect Chicago Homebound program has been using the Johnson & Johnson vaccine. We have decided to pause all homebound operations at least until Monday, April 19. We have already called everybody who was scheduled for an appointment to express what was happening, that we would be looking to reschedule. People broadly continue to be interested in receiving the vaccine once this investigation is complete, assuming that it is still recommended for them to do so. We continue also to call down all the approximately 5,000 people who have registered for the homebound program. We know that there's a lot of demand for that program and remain committed, but we do want to give a few days so that we can know what the next steps are at the federal level. On a smaller level, we had Chicago Federation of Labor points of dispensing for Thursday and Friday that are at this point being postponed until the week of the 19th. We had a kickoff event scheduled in Albany Park with the Illinois Restaurant Association. Our vaccination bus had stops in South Shore and West Englewood. We had some faith initiative work, and we had strike teams with employers, low-income housing. All of these, at least in the next few days, are on pause while we're waiting to understand understand next steps related to use of vaccine and understand where we may be able to make some adjustments with incoming vaccine to be able to cover these potentially with other doses. Finally, the United Center. The United Center was not scheduled to change to Johnson & Johnson until April 20th. So we continue to vaccinate with Pfizer at this point, and we are waiting to hear from FEMA on their intended plans for vaccination. Obviously, this has a lot of operational impacts based on their decision, and we have not yet heard what the plan there is. That vaccine is allocated directly from the federal government, and so we will need to hear from them about timing and next steps there, but it does not affect anything for the next week. We have paused Johnson & Johnson appointment making right now at the United Center until we learn more. We did share information out with providers and have been working to make sure people have the information that they need. And I just want to finish by saying that, all reports of adverse events following vaccine are important. We always want to look into them. Vaccine safety remains our absolute top priority, but reiterating, this is a rare but severe type of blood clot, and I fully support the decision of the CDC and the FDA to recommend this pause while they're understanding the event. And we'll be watching tomorrow when the Advisory Committee on Immunization Practices meets. That is an open meeting. We'll be watching to learn more about these cases and about plans moving forward. And with that, I will ask Dr. Geraldine Luna to come up just to give a summary of some of that information in Spanish, and then we'll come back and take your questions.
Muy buenas tardes. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Yo les venimos a dar las últimas noticias acerca de la situación de la ciudad y también queremos hacer énfasis de la seguridad de la vacuna de Johnson & Johnson y queremos hacer unas reseñas acerca de eso. Para empezar, los casos lamentablemente siguen escalando. Ahora vemos un aumento también en casos de personas caucásicas, afroamericanas y latinas. Son personas jóvenes. Así que les pedimos encarecidamente que sigan las preventivas. La vacunación es una parte importante, pero no lo es todo. Tenemos que evitar las congregaciones. Lo vemos en jóvenes haciendo deportes, congregaciones, grupos sociales. Sabemos que el clima se presta, pero todavía estamos en medio de una pandemia y los números siguen aumentando. La seropositividad se encuentra ahora en 5.7. Hace 2 a 3 semanas atrás estábamos en 2.7. Eso es un aumento alarmante. Los casos aumentaron a casi 700. Tenemos 691 casos cuando estábamos cerca de los 300 hace como 2 semanas. Siguen aumentando los casos. Las visitas a la sala de emergencia y hospitalizaciones se encuentran en 130 diarias. Esto es un aumento no tan significativo como la seropositividad, pero mucho más de lo que teníamos hace 2 a 3 semanas. Y los aumentos en intensivo no han escalado como los otros indicadores de la salud, pero sí han aumentado y no han escalado más gracias a que las personas de la tercera edad, en su mayoría, ¿verdad? 60% ya han recibido las vacunas y esperamos que esto inste para proteger a todas nuestras personas de 65 años o más. Las muertes hoy en día se reportan de 3 a 4, no han subido alarmantemente. Otra vez pensamos que esto ya estamos empezando a ver los beneficios de la vacunación. Nuestra eficiencia sigue siendo la mejor. Nos sentimos mucho orgullo de la eficiencia que tenemos distribuyendo las vacunas. Semanalmente, de todas las vacunas que recibimos, 95% se van a las alocaciones, a las áreas donde han sido designadas para el uso de nuestro público. Estamos vacunando semanalmente a razón de 90% de la capacidad de las vacunas que van entrando. Esto nos llena de orgullo y, ¿verdad?, felicitaciones a todos los que están recibiendo estas vacunas. Ahora mismito el porcentaje de vacunación en adultos se ve de 1 a 5, así que instamos que se sigan vacunando. Esta es una parte muy importante. Y las vacunas ya están sobre 1.6 millones recibidas aquí en Chicago, y eso nos pone en una posición muy aventajada recibiendo las vacunas. Ahora, sabemos que han escuchado las noticias que Johnson & Johnson, ¿verdad? Se han hecho nuevas recomendaciones basadas en la seguridad en nuestros pacientes, en nuestros miembros de la comunidad. La seguridad de la vacuna siempre ha sido nuestra prioridad principal. El Departamento de Salud Pública apoya que, de acuerdo con las recomendaciones del CDC y la FDA, la ciudad de Chicago ha detenido o pausado la administración de las vacunas de Johnson & Johnson mientras nuestros funcionarios federales completan las revisiones e investigaciones pertinentes. Estamos colaborando con nuestros socios a nivel federal y local para determinar cómo esto impacta las operaciones de vacuna de la ciudad. Las agencias federales están investigando informes muy escasos de tipo de coágulos sanguíneos severos que se han reportado con plaquetas bajas que ocurrieron en 6 personas de casi 7 millones que han recibido la vacuna de Johnson & Johnson. Estos casos son increíblemente raros, pero son consistentes, entonces la seguridad, otra vez, es lo primero. Cualquier persona que haya recibido la vacuna de Johnson & Johnson y desarrolle dolor de cabeza intenso, dolor abdominal, dolor de piernas, dificultad al respirar, dentro de las próximas 3 semanas posteriores a recibir la vacunación, es importante que vayan a buscar atención médica. Esta recomendación no afecta a Moderna o a Pfizer. Estas vacunas son seguras. La vacuna sigue siendo fundamental para proteger a los habitantes de Chicago del COVID-19 y compartiremos más información a medida que la recibamos. Hay varios sitios donde se han pausado la vacunación y queremos informarle que seguiremos administrando Moderna y Pfizer como lo hemos estado haciendo en nuestros centros de vacunación, en nuestros centros masivos. El United Center está recibiendo las vacunas del gobierno federal, así que vamos a estar atentos después de la próxima semana a ver qué suministro nos envíe. En el Chicago, la Federación of Labor está tomando las medidas pertinentes para seguir, vacunando de Moderna y de Pfizer. Y el Chicago State University, la ciudad le complementa y will be changed immediately. O sea que va a cambiar inmediatamente a Pfizer. De Johnson & Johnson va a cambiar a Pfizer. De haber cambios, todas estas personas se les están llamando, se le están haciendo, ¿verdad? Las citas para recibir su vacuna. Se le están posponiendo o dando diferentes citas para recibir su vacuna a las que ya la tengan, pero las personas que tengan cita para recibir Moderna y Pfizer continuarán recibiendo el esquema como se les ha indicado. Recuerden, la seguridad es nuestro primer indicio, nuestro primer paso cuando tomamos decisiones. Gracias.
Thank you, Dr. Luna. Happy to take questions.
Dr. Arwady, thank you. Can you characterize how much of a setback is this?
So, a couple things I would say. Number one, we all care the most about confidence in vaccine safety. And I think the fact that this decision was made to put J&J on pause, for me, is a signal of how strongly we take vaccine safety, how strongly we consider that in this country. I know it was a difficult and fairly quickly made decision at the federal level, but I hope that people will take this, as I take it, to be a sign that if there is even what we call a safety signal, a concern that there could be an issue here, first and foremost, we work to pause, we work to understand that, we work to make sure that providers have the most important information, and then once the full investigation is done, we're transparent about if there need to be changes with this vaccine moving forward, we will do that. My bigger concern is that I know that a lot of, comparatively, most people in this country have been vaccinated at this point with Pfizer and Moderna. I do want to underscore that we've seen no concerns of this related to Pfizer or for Moderna in 180 million doses of this being given. There's not been, to my knowledge, a single event reported like this. But nevertheless, I know that not everybody thinks in terms of the different kinds of vaccine in the same way that I do. And I worry that people may have decreased confidence and more concern about side effects as a result of this. And at one level, that would be a very natural thing to be concerned about. And so I would ask people to have a little bit of patience here, to trust that the reason this pause is on is because we want to fully understand these rare events and be able to make sure that all of the recommendations that we make about vaccine are based in the best science with safety and efficacy first and foremost. So I am concerned because I know people will have concern when they hear this, and we want, getting Chicago past COVID, getting the U.S. past COVID means getting us vaccinated. So I fully support the decision, but I want to encourage people to keep their Moderna and Pfizer appointments, to keep making those appointments, and as we learn more about Johnson & Johnson, we'll be back in touch.
How much will this slow down the vaccination rate?
So I think it will have an impact, probably not as large an impact as it might have, simply because we had already seen a slowdown in the amount of Johnson & Johnson we were receiving because of some of the manufacturing problems. So just to give you some perspective on this, we had received a one-time 40,000 Johnson & Johnson allocation, which we had then seen drop to fewer than 5,000 doses in this current week that we're in. We had spaced some of that out over a few weeks, but it is of the three vaccines, it is the one that has been by far the one we've administered the least of, but it's been an important vaccine for us in terms of the one and done, the lower side effect profile. And my hope is that after this review is done, if there was something in these women who had this really severe side effect that perhaps put them at higher risk, or there could be a recommendation, perhaps not for a particular group, we may continue to be able to use this vaccine, but perhaps with some other precautions around it, but we don't know yet. So I think it will certainly have some impact, but as you see, one of the reasons I showed this data is that we are putting vaccine in arms just as fast as we can get it here. So we're doubly committed with the Moderna and the Pfizer, and we'll keep going just as quickly as we can with those.
Is CDPH reaching out to everyone who got a J&J vaccine so far, and what are you telling them?
So we, at this point, the first priority for this morning was to reach out to people who had J&J appointments scheduled in all of these settings that I was reading through, because we want to make sure we're communicating what's going on there, what's the planning there. I think we certainly, in terms of sharing this at a high level, I know it's a large national story, people are hearing this. If people already got the Johnson & Johnson vaccine, there is nothing that they need to do differently at this point, except to monitor in case they were to have these significant side effects. Again, with fewer than 50,000 people having gotten the J&J vaccine, and at this point, the rate of this severe side effect that we're seeing is about 1 in a million, I would not statistically necessarily expect anybody in Chicago to have one of these events, but it is impossible. And so I would like to have ACIP. I'd like to see what they recommend tomorrow with a little bit more detail around that, and then we will be communicating some more. Just to put one other piece on this, because we were already getting some questions. This is different than the short-term side effects of just a couple of days. If people got a Johnson & Johnson vaccine in the last 2 to 3 days and they're having, they're feeling tired, or they're having a sore arm or a little bit of a headache, that's not what we're talking about. We're talking about really a more severe headache, more severe side effects that are coming more in the typically, in this case, they ranged from 6 to 13 days after vaccination, but we're saying up to 3 weeks, just to let folks know. So
I do have more, but go ahead.
Yeah.
Thanks, I appreciate it. Do you know why, or can you give any additional context as to why the rates are increasing across racial groups at this point in Chicago, not just a north side versus south side issue, just given segregation in the city?
Yeah, so, we have and continue to have a widespread COVID outbreak in Chicago. So it's not, when we show that we are disproportionately seeing more cases still on the north side, there is no part of the city that has not seen COVID and has not continued to see COVID. We've continued to see cases and hospitalizations out of virtually every zip code, right, over this last month. And the problem is that as cases grow, and so although we have seen more, like I said, in the northern part, it is a widespread outbreak, and we are seeing those increases across all groups, and do need to continue to push on vaccination across the city then as well.
And on that level, I was wondering, you mentioned last week that there were smaller percentages of Black Chicagoans younger than 44 than in any other racial group who had gotten the vaccine. Has there been any progress on that in the last 2 weeks, and what's the strategy CDPH is using to try to address that issue?
Yeah, definitely. So, one of the concerns, or one of the things that is making this news particularly difficult is that there is a lot of demand for Johnson & Johnson, and we have heard that when we've been out in communities, people wanting to do a single shot, particularly if they had had COVID in the past, concerned about side effects, really interested in the single vaccine. And so we had worked quite hard. Some of these events that I ran through, like some of the faith-based events, some of the vaccine bus events, really trying to bring vaccine to people in a way that may not always require an appointment, doesn't require that second dose. That kind of approach has been important for some of our predominantly Black neighborhoods. To be perfectly clear, we have also used Johnson & Johnson we used it for the airlines, including the executives. We've used it for a whole range of employers. That's not been the only focus. But it is true that where we continue to see lags the most are in younger Black Chicagoans. And there's a whole range of things that we're doing to work on there. I do want to put that in a little bit of context, though, because we've been watching pretty closely vaccination rates across large cities. And not only are we ahead of, where we look at the 10 other large cities in terms of coverage rates, we are by far the furthest ahead for Latinx coverage compared to other large cities. And we were second in terms of Black coverage. So although we have a long way to go, we are I think with this really focused work, doing still better than a lot of places, but there's a long way to go. So we will be adjusting J&J to push some of these other vaccines to some of those areas, and be working with the partners that we've been working in there to try to get people's questions answered, and try to keep vaccine confidence high.
And just, anecdotally and on social media, this news is obviously not going to be good for vaccine hesitancy going forward. Can you give any idea about what CDPH strategy is going to be like in the months ahead, either short-term responding to this right now and long-term about what it's going to be like?
Yeah, so, I think there's a couple things. One is that, we remain very committed, as I said, to following the science on this and being very transparent about it. I want to be really clear with everybody what we know, what are we still learning, and make sure that people have that information. I definitely want people to hear how rare this is. One of the reasons, I think, why the CDC made the decision to announce this when it was so rare is because the way that this is presenting, healthcare providers need to treat it differently than they would otherwise. Usually when people come in with a blood clot, you treat it with a medicine called heparin, which helps thin the blood. And the way that this is presenting with both a blood clot and low platelets, you would not want to give heparin. You'd need to give a different treatment. And so part of this announcement was also just making sure that if there are other events, that providers know about this and know to check people with either low platelets or blood clots, know to check and then be able to treat them appropriately. But the bottom line is that this vaccine, the Pfizer and the Moderna in particular, the safety and efficacy on this vaccine has really been unparalleled. We have never had a vaccine with a, this kind of 90% type plus efficacy, and these safety concerns, again, have not been related to Pfizer and Moderna, and it uses a different process. So we're going to talk to people. I want to get the full information. We learned about this morning, like everybody else did. And so I want to make sure we know everything so that we can answer people's questions. And I think we'll have more of that just over the next day or two.
Dr. Arwady, the state today, Governor Pritzker tweeting out a promise of 50,000 doses to Chicago to help out. Is this going to be enough, and how much if you can characterize how important this is, how much this will help?
Yeah, so certainly I was very pleased to see that. As you know, we've been pushing quite hard, really asking at the state level and at the federal level, with cases surging here and us having excellent efficiency numbers, but having vaccinated a lot of non-Chicagoans because of our healthcare focused and employer focused work. So certainly, 50,000 doses helps. We had gotten 40,000 Johnson & Johnson the previous week, so just to give you a sense of being able to fill in some of those gaps. And I hope that it really marks continued ongoing partnership here in terms of making sure that parts of the state that are surging and particularly parts of the state that are relatively under-vaccinated can get vaccines. So I was pleased to see it. I also want to thank Indiana, actually, who opened vaccine eligibility for Illinois residents because similar to downstate Illinois, Indiana has been having vaccine that has not been having good uptake. And so at the Gary site in particular, we've seen huge numbers of Chicagoans taking advantage of that. And so, I really want to appreciate everybody around us who's working. Everybody recognizes that getting Chicago vaccinated is critical for the region.
The whole fallout from this, with fewer vaccinations perhaps available, greater hesitancy or greater distrust, what concerns do you have that the impact of this overall could have on the test positivity rate?
So our test positivity rate at 5.7% remains quite good. I would like to have it less than 5%, but where I look across the South, for example, I was looking at some of this, I think it was Alabama, which has a relatively low case rate, has a positivity rate of over 11%, and that really reflects that people are largely not testing, probably unless they're heavily symptomatic. And I do want to emphasize that while COVID cases are not only here, but on the increase, it's critical that people keep up the good testing behavior that we've seen here. We're averaging more than 13,500 COVID tests per day. That's about 3 times the minimum of what we need to be. And we've been seeing that grow in proportion with COVID cases. So I would encourage, again, people to remember the basics, that, wearing your mask, socially distancing, staying home when you're sick, getting your test, and then getting vaccinated when you can. And right now, that means getting vaccinated with Moderna or Pfizer remains the best way to protect yourself, your family in Chicago from COVID.
Dr. Arwady, could I also ask you, we're getting a lot of questions from people who say they had a bad headache the next day that went away after 24 hours. Is this still considered a red flag? How long might these symptoms persist? And if they are only temporary, is that still a concern?
Yeah, that's a great question. This is different than the short-term reactions that we will see in people, in the 24 to 48 hours right after they get vaccinated. So this is in no way related to, at least based on what we know now, it is not related to any short-term effects. The thought on this, if this does turn out to be linked in some ways, that is probably immune-mediated, and your platelets have about a 10-day lifetime in your body, and it takes time for this to show up. And so if people had a headache in the day right after they got vaccinated and it went away, I would not have a significant concern about that at all. This is more if you were to see a severe headache, abdominal pain, leg pain, or just other concerning symptoms appearing, more in the kind of 1 to 2 weeks post-vaccine, and we're saying up to 3 weeks at this point. We would want people to seek medical care, but these are the things that we would want people to seek medical care for anyway. And it's just making sure that they share that they've gotten the vaccine, and then we've been doing a lot of communication to our doctors here so they know what to test for and what to look for in case people are coming in with these symptoms.
And off topic, what would Biden's lead pipe proposal mean for the big city residents, for the city residents of Chicago?
Sure.
If Congress does approve it.
Yeah, so I was very pleased to see attention to lead service lines in the Biden administration's proposals. The city of Chicago has a lot of these. They are a legacy infrastructure issue that, as you know, we have very much started to address here, but this is a problem that was decades in the making, and it is likely to take many, many, many years to address, and a lot of funding. So I was really pleased to see that attention to lead service lines. I also want to reiterate that we do, at the Chicago Department of Public Health, we look at every single child's lead levels, and the number one way still that we see children getting lead poisoned in the city of Chicago remains from lead paint as opposed to lead in water. And so we want to also make sure that I'm very hopeful that some of these very large, costly infrastructure things are addressed, that we also continue to make sure that we're addressing the lead paint issues in indoor housing. And I'm hopeful that will also be included as Congress is thinking about.
Sorry, one last one. I'm sorry, it was brought in late. What are the numbers by age for hospitalizations? Does that also track with younger residents representing most of these increases?
Yeah.
Are more 18 to 29, 30 to 39? What about those hospitalizations?
Sure. So we've looked at that, and we are seeing more of the increased hospitalizations among people under 50, very different from what we had seen previously. Again, just reflecting how important vaccination has been to protect those older folks. So if you look at it, it's really, those under 50 on top, and it kind of goes down backwards. So people in their 50s, 40s, 30s, the opposite of, just like what you would expect, younger people less likely to have the severe outcomes. But the vaccine is clearly playing a role here in how we are seeing severe outcomes show up, which is why I, again, even in the context of this J&J news, want to emphasize that especially older people, and especially with people with underlying conditions, your risk of being hospitalized or dying from COVID remains much higher than your risk of having this very severe side effect because it is so unusual, even if you had gotten the Johnson & Johnson vaccine. So these vaccines work, and they are the way we're going to get out of COVID. But yes, broadly, people under their 50s, we are also seeing higher hospitalization rates among Black Chicagoans as compared to other Chicagoans, consistent with what we've seen at other points in the outbreak.
Thank you. Thank you.
Thanks.